As you've heard, my name is Markus Van Niekerk, and this has been my research topic in my final year of medical studies. I have recently graduated as a medical doctor. I do not have any conflicts to declare about this research. I am the sole author, and I claim this work to be my own. I have had no endorsements from any institution whatsoever, and I have not received any financial contributions in any form. The topicality of this research, so it's a novelty study that was conducted, and female masturbation practices is a topic that has previously very much been neglected in the research field, and it's of high relevance to both the public and female health. And the aim of it was to show the current shortcomings that we can see in published guidelines, as well as then to encourage improvement of it and better contribution of it in the actual programs and improvement of sexual health of especially females overall. In Latvia specifically, sexual education is not a mandatory component yet of school education curricula. And this study will also highlight the relevance of why it should be given in like all of society in general as well. The first part of my study was a literature review. It consisted of 5 chapters. And I briefly delved into the history of female masturbation from biblical times, taboos of the past, as well as then our current society's perception of it. I then looked at the possible effects that religion, parental views, and culture can have on the female's perception of masturbation. And then as well, looking at the sources of sexual education programs, especially in the USA and the European Union, and the efficacy of. And then looking at the evolution of pornography industry and the possible effects that can have on young adolescent users. And finally, looking at the importance of female masturbation for sexual health, including risk factors if this is not met. The part of my research, as mentioned before, it's been a cross-sectional study of female masturbation practices amongst these different populations, age groups, and the possible influencing factors thereof. My hypothesis for this study was that religion, culture, and parental factors could influence one's views on masturbation, that schools do not provide sufficient sexual education, including the teaching of masturbation for females, as well as to allow women to feel well informed for safe and consensual sexual activities. And thirdly, the frequency of orgasm when masturbating and when engaging in sexual intercourse is not dependent on age. The aims of the study tie in with a hypothesis, and so it basically is looking to see if these sexual education programs is thorough in teaching about female masturbation, to see if the culture, religion, and family influences can have an effect, to see if females from different age group experience orgasms just as often when they masturbate compared to when they engage in sexual intercourse with a partner, and to also see what mode of masturbation makes females orgasm most frequently, and lastly, to see what emotions females experience when they masturbate and whether they are more positive or negative. The methodology used, so it was a cross-sectional anonymous online questionnaire, as well as a literature review. It had 24 open questions that were both multiple choice or open-ended, depending on the participants' willingness to answer, and it was collected via a sample of convenience. Inclusion criteria was female or those identifying as female and 18 years and older. After the study was conducted, there were only several participants who indicated that they were not biologically by birth female, and thus it would have allowed too many unforeseeable factors to include those that only identify as female. So for the aim of this study, we included only those that were biologically female. The study was also approved by the RSU Ethics Committee, and it was open to fill in for 3 months time period and promoted on different social media platforms and by word of mouth. The data was then analyzed by the SPSS 27 system. And then to the actual results. So with a sample size, we received quite a large sample size for the study, and it's 1,068. We divided them into 4 different age groups: 18 to 25, 26 to 40, 41 to 60, and 61 or above. And here you can see that the distribution of the participants were then distributed into the continents. So first of all, European Union and North America showed majority of participants, followed by Asia, Oceania, Africa, and South America. Then looking at the depth of sexual education that provided in these schools. So every time with the results, you will see that we actually have the different age groups. And this was to see if the programs have actually changed amongst the years. So here you can see that 64 to 75% majority amongst all the age groups indicated that it was only partly provided, followed by 84 to 85% saying that female masturbation was not even mentioned. Followed by 43.3% to 55.8% saying that these sexual education programs were not sufficient in preparing them for safe consensual sexual activity. And then we looked at how premarital sexual activity was considered as, so whether it was allowed, discussed, forbidden, only discussed to inform, or allowed but not discussed, so only partly. And majority of answers here said, 42% said that it was allowed but not discussed, with only a mere 17% indicating that premarital sexual activity was actually allowed and discussed. The next results showed the masturbation was conducted by the participants despite prohibition of premarital sex. So the reason this question was asked was actually to see if sexual activity was prohibited, if the participants would connotate this to also masturbating or not. And amongst those that said that it was prohibited to have premarital sex, 8% did not masturbate, but 38% still did. Next, we assessed the frequency of masturbation, and majority here showed that they masturbate more than one time per week, followed by those that masturbate every month, but less than one time per week. In the next result, we can see which mode of masturbation most frequently ensured orgasm. And here you can see that majority said that it was with the use of sex toys, such as vibrators or dildos, followed by their own hands at 42%, followed by the partner's hands at 10%, and other methods at 4%. Here you can see the frequency of orgasm when masturbating. So 59% of females said that they always orgasm when they masturbate, followed by 26% often, 7% sometimes, followed by 4% rarely and never. We then assessed the frequency of orgasm now during sexual intercourse. So you can see the always answer has dropped from 59 to 15%, which is a staggering amount, followed by often at 30% and sometimes at 25%. We then looked at the emotions females experience during masturbation. Majority of emotions were considered as positive, so emotions such as relief, euphoria, peacefulness, happiness, empowered. But there was also a large amount or substantial amount of participants who had no emotion, which was 141 participants, as well as a substantial amount that experienced negative emotions during masturbation, such as guilt, disappointment, sinfulness, and sad. The conclusion I could make from my study was that the depth of sexual education programs in the schools was insufficient in teaching these students about female masturbation practices and preparing students for safe consensual sexual intercourse. The frequency of always reaching orgasm was highest during solo masturbation compared to engaging in sexual intercourse with a partner, irrelevant of age. The most frequent mode of masturbation that always ensures orgasms are sex toys followed by their own hands, and majority of women experience positive emotions during masturbation. The shortcomings of my study, initially I wanted to reach sample size for my university as well as the other large university in Latvia, and being able to compare them, since the other university is mostly local students. So then I could have reached an international versus local students comparison, but this could unfortunately not be made. This study was obviously distributed as wide as possible with the goal of reaching a valid sample size that was not biased by sharing it with everyone possible. But one would only expect that those who would be willing to fill it out would fill it out, since it's quite a private topic. Even though it was anonymous, there was still quite a lot of response from people saying that they do not feel comfortable filling it out. And obviously then the opinions of those not willing to discuss their opinions based on culture, religion, or personal privacy was not gained, even though those are ones we would really like to gain. Some results I did not show in this PowerPoint was that one of the questions was also if the females have ever undergone female genital mutilation, and 12 of the 1,068 participants said that they did undergo female genital mutilation. The questionnaire also did not further explore the impact of parental, cultural, and religious views on women enough. This could be suggested as a next qualitative study compared to this one. And finally, the proposals I have from this research is, since there's outdated information online on studies like this, or it doesn't involve such in-depth studies in the past, that this study should be used as a foundation for further research in female masturbation practices, as well as sexual education programs in schools. And Latvian, as well as other EU member states, as well as the US, they need to review their current guidelines and the programs set in place, and develop definitely a more efficient way to ensure sexual education is provided in the school's curricula amongst all the different member states, and actually see why, even though the sexual education programs have been brought into the school system in the last 20 to 40 years, why it has not improved the participants' answers on whether it was partially or completely or thoroughly taught enough, even though those are the results we expected to have between the younger and the older participants. It was not the case, unfortunately. So we've come to the end of my presentation. Does anyone have any questions?